Congratulations on your pregnancy, and thank you for choosing Valverde Regional Medical Center for your delivery. Our Women's Center offers care for women of all ages, women with normal or high-risk pregnancies before and after they give birth, and women having surgery or other health issues. When you arrive at Valverde Regional Medical Center, you will be screened at the main entrance. We continue to follow the highest levels of safety precautions due to COVID-19. Your health is our priority, and we want to keep you and your baby safe. Once you get screened, you will need to walk to our admitting and registration area. Don't forget your ID and insurance card. You can pre-register ahead of time to make the process quicker. After hours, you will need to enter through the emergency department. They'll register you and get you where you need to go. Remember, if you're having contractions that are regular and 5 minutes apart, if your water broke, if you're bleeding, or if you feel sick and dizzy, you need to go to the emergency department. Our Women's Center is located on the second floor. Once you leave the registration area, take a left turn and follow the signs to the elevator. On the second floor, exit the elevator and take a right. You'll see this next to the door. Press the red button for assistance. This is a secure unit to keep you and your baby safe. Once you arrive at the nurses' station, our nurses will ask you a few questions before taking you to a delivery room. The Women's Center uses a cuddle system for security. Your baby will have a band on their lower leg with an alarm. If anyone should attempt to take your baby out of the Women's Center, they will be stopped. Outside food is allowed. However, you may not want to eat too much during labor just in case you need an anesthetic at a later phase. Until the COVID-19 pandemic is under control, you will only be allowed one support person with you. For everyone's health and safety, no other visitors will be allowed. VVRMC's Women's Center currently averages about 65 births per month. Intervention measures such as forceps or vacuum extraction are only used rarely. The goal is for every mom to have a natural birth unless it is not safe to do so. We have 1 triage room and 2 observation rooms, along with 5 labor/delivery/recovery rooms. When a mom-to-be arrives in labor, she will be checked into one of these rooms. If admitted, she will stay in this room through delivery and will usually be moved to postpartum care in about 2 hours. We do not offer any specialized, non-medical equipment for delivery. However, you can bring whatever you feel will be helpful for you. If you've created a birth plan ahead of time, be sure to give a copy to your OBGYN. When you arrive at the Women's Center, give a copy to your nurse. You will give birth in a labor and delivery room. It has monitoring equipment and more to assure a good experience for you and your baby. After you recover, you and your baby will go to another room to rest up for your journey home together. However, it is possible that you will be in the same room for the entire stay. All the rooms have private showers and a place where your support person can sleep. The most common anesthesia option is the epidural. Generally, you can receive an epidural when you reach 4 cm dilation. However, every birth is different, but rest assured, anesthesia is available 24/7. If you need a C-section, one of our surgeons will be called in. On average, approximately 24% of births at VVRMC are done by C-section. This is lower than the average rate in Texas, which is about 30%. Keep in mind that the exact percentage fluctuates month to month. We try to accommodate your wishes for your birth experience, so skin-to-skin contact and delayed cord clamping and cutting are allowed. We have both wireless and non-wireless fetal monitoring at VVRMC. Vaginal exams are kept to a minimum. They are only done as necessary during labor. After you deliver, your baby will stay in the same room as you. You'll both have the same nurse, and if your baby needs to go to the nursery for a test or procedure, they will be in the care of the nursery nurse. Your nurse will also be the person who keeps you informed in case your baby has to spend some time in the special care nursery. If you have a vaginal birth, you will stay with your baby for 24 hours. If you have a C-section, you will stay from 48 to 72 hours. Keep in mind that every birth is different and the stay is flexible depending on the birth situation. Pacifiers and bottles will not be given without parental permission. That is your decision to make. Someone from Medical Records will come visit you while you are in the Women's Center to help you fill out paperwork for your baby's birth certificate. We're here to help. Thank you for joining us on this tour of VVRMC's Women's Center. If you have any questions that were not covered in this video, please feel free to give us a call at 830-703-1711. Make sure to visit our website at www.vvrmc.org for more information and a free hospital bag checklist. Valverde Regional Medical Center, providing healthcare you can trust.